Welcome everyone to the fourth meeting of our 23-24 webinar series. And as you know, the first four meetings are on financial assistance programs available to the Fabry community. And our next webinar will start another series. But for this one, we have a presentation by the American Kidney Fund. So I'm going to first introduce Casey McKenna. Casey is a senior program manager for education and community support programs for the National Fabry Disease Foundation. Casey is a genetic counselor, certified genetic counselor, and then she is going to introduce our speaker, and then Mike will give us a presentation on what they do. Thank you very much.
Okay, well, thank you, Jerry. And welcome to Michael Spigler, who is the Vice President of Patient Services and Kidney Disease Education at the American Kidney Fund. There, he oversees a spectrum of programs and services, including prevention activities, top-rated health educational resources, and directing financial assistance that enables kidney patients to access life-saving medical care, including dialysis and kidney transplantation. Please welcome Mike Spigler.
Well, thank you all very much. And I was very honored to have Jerry ask me to do this. We are really interested in trying to help anywhere we can with the rare disease advocacy groups that are out there in the community and trying to do this. So very happy to do this. And as Casey said, any questions you have throughout, please don't hesitate to ask. So let me just give you a little bit of an overview of who the American Kidney Fund is. We were founded actually back in 1971, and the fund part in our name is kind of where that all came from. So we started with really just trying to help one person who could not pay for dialysis before Medicare and other things paid for that. So we have obviously grown very much over that time frame. I'll come back to financial assistance in a second, but just a little bit of an overview of what we do. Obviously, we do, like many other health nonprofits, awareness campaigns around chronic kidney disease, the risk for kidney disease, and also for rare kidney disease. We have a project called the Unknown Causes of Kidney Disease Project that also helps people that know they have kidney disease but doesn't know what the cause is, try to figure that out. So obviously a relation there to this as well. On the advocacy side of things, we're nearing close to 30,000 ambassadors around the country. We do both state and federal advocacy. One of the big things that a lot of the community is doing is trying to get living donor protections, which I'll talk about at the very end of my talk, just very briefly as well as some other bills. We're trying to get a bill passed right now to get genetic counselors covered under Medicare, which they aren't right now. So that's an important piece that we're working on with the National Society of Genetic Counselors as an example. Obviously, for the kind of quote unquote traditional kidney disease, prevention is a big part of what we do, trying to make people that have diabetes or high blood pressure aware of their risk for kidney disease. And we do that through public education. We have webinars like this as well. I'll talk about some of those things at the very end of the talk as well. From professional education, we have free courses for healthcare professionals, whether it's allied healthcare professionals like nurses and social workers to physicians. We do a little bit of research as well. We have a program that's been going on now for, it's 30 plus years. Our clinical scientist and nephrology program, which is meant to keep young nephrologists in the field of academic research, because right now we're losing a lot of doctors that end up going to, run, the medical directors at dialysis centers and other places. And we want to keep them in the field of research because we all know how important that aspect is. And then the main part of my talk today, and what I'll go more in detail on, are financial assistance programs. So we assist about 1 out of every 7 dialysis patients in the country, and also recently transplanted patients, with some form of financial assistance. And I'll talk through those right now. So the first program, the one that probably we're most known for, it's the biggest program that we do, is our health insurance premium program. If you've been in the field for a while, you've probably heard that note called HIP. And again, this helps dialysis patients and also recently transplanted patients keep their health insurance coverage. So, when you're thinking about 1 out of 3, I've seen 40%, 60% in some studies of people that don't ever know that they have kidney disease till they go to the emergency room for the first time and are told they need to start dialysis. This is a really important program, especially if you're, the breadwinner for your family. So we can help, during that process, maintain that health insurance plan as one example. But the biggest use case of people that get financial assistance from us are those that have a combination of Medicare and Medigap. That's about 60% of our patients. So we'll help with Part B premium and also like a Medigap premium as well. And we have a few patients where we have Part C coverage too. Obviously commercial coverage when that makes sense, COBRA, and in the few states where there's a small Medicaid premium, we have that as well. And again, we assist with up to 2 different insurance plans, and I mentioned what that most common one is. Last year, we had about 62,000 patients that we helped with that. It's a little bit higher this year. I don't have the year-end numbers obviously just quite yet, but it's trending a little bit higher than that. And I think the thing that we are most proud of, certainly I'm most proud of, is we help about 150 patients every single month, in large part get a kidney transplant. And for those patients, it really is, if you look at who's getting transplanted, they're usually traditionally underserved patients that usually aren't able to get a transplant in kind of the general pool. So it's really making a difference in some of those disparity gaps that are out there. The other big program that we do is our safety net program. And this program is a small grant, admittedly, but it's really meant for an emergency situation, an electric bill that was more than you thought, out-of-pocket expense for a copay, your blood pressure cuff broke and you need a new one, like those kinds of things. It's a $200 grant. It's available once per year. If you happen to live in DC, Maryland, and Virginia, it's slightly higher. It's $250. That's thanks to a private foundation gift that we have there. And we help somewhere in the range of 10,000 patients get a safety net grant every year. It's again trending a little bit higher this year. I think we'll probably be closer to about 11,000. And I said, covered pretty much anything here, anything that's at all related to your treatment, nutritional supplements as well. Transportation is honestly our biggest one. Public transit, gas in the car are really our biggest things that we do. For both of these programs, we determine your eligibility on financial need. You also have to receive treatment in the U.S. or its territories. We don't do any kind of citizenship testing, but obviously you have to, be doing the treatment here. You must already, for the health insurance premium plan, already know what health insurance you want. We have no role in that. We don't help you pick your coverage. In fact, we don't start coverage. You send us a bill showing you've already, secured it and meet the eligibility requirements. And we really encourage everyone to make sure that they are carefully reviewing all of their potential insurance that's available to them, including Medicaid. Now, the way that we test for the financial part of this is a couple of different ways. So first off, the household income, I personally think for a charity program, it's pretty generous. It's 500% of the federal poverty level. So that's based on where you are in the country, in the lower 48, or if you're in Hawaii or Alaska, it goes up a little bit higher. And it's also based on your household size. And then liquid assets as well may not exceed 30,000. Now that may seem like a lot of money, but what we didn't want to do is, we know that I have certainly heard anecdotally and talking to some patients that some transplant hospitals may require a significant amount of money in the bank to make sure that you have, money to pay for the medications after transplant. So we certainly didn't want to do anything that was going to put those two things in conflict. So you can have liquid assets up to $30,000. And if you are already in something like one of the public assistance programs, like SNAP for food assistance, or LIHEAP, or TAN for any kind of housing assistance, even like fuel assistance in your local area, if you send us something like that showing you're already in that program, you don't need to do the other means testing. We'll just put you in the program straight away. Hopefully none of you will ever have to experience this, but if you end up in an area where a natural disaster occurs, if it's for dialysis or transplant patients, we can provide a one-time grant of up to $250 Now that will depend and may go up or down, usually up, depending on what we're able to fundraise around a particular disaster. As a great example, the wildfires that happened in Maui this past year, thanks to some generous donors, we were actually able to give $1,000 of assistance out. But we try to target at least $250. That's kind of, I would say, kind of our basement for what we try to do with this program. This really started as for people like in hurricane zones that might not want to evacuate because, well, I can't even afford a hotel room or to get out of town. And we didn't want that to ever be the case. So that's kind of where that number started and where we started that program. But again, much like our safety net program, it can be used for just about anything related to your treatment, but also replacing clothing, food, those kinds of things. And again, these have to be natural disasters. So this wouldn't cover something like, your house, your basement flooded, or there was a fire in your house. These are natural disasters, earthquakes, hurricanes, ice storms we've done before, massive flooding events. Hopefully I'll never be around for one of these, a volcano, but that would be covered too, those kinds of things. All of our programs are done through an electronic process, and this is the website where you could go and register to do that. It's our grants management system, so it's gms.kidneyfund.org. You can start the process even as a patient or as the caregiver for a patient on your own. There will be a step in the process where you will need, either your dialysis social worker or your transplant coordinator or your transplant social worker to confirm that you are a patient there. Obviously, we need to make sure that you are a patient in need. But you can start the process there, communicate with us, track your grant through the process, all on kidneyfund.org. And we have two state-specific programs that I want to talk about as well. We occasionally get funding based on a donor in a particular area. I do believe these next two will probably be around for quite some time, but I just want to put that caveat out there. The first is one we actually just launched on December the 1st. And this is a living donor program with helps with up to $2,500 in assistance for out-of-pocket expenses. These are for patients who are having the transplant surgery done at a Massachusetts hospital. You could come from wherever, right? You could live in Providence, Rhode Island, and come across, as long as the transplant is happening at a Massachusetts hospital, and people can come from wherever. So if you're a living donor coming from California to give to someone that's in Boston, as an example, you would still be covered as well. It's really about where the surgery takes place. It's meant for travel-related expenses, out-of-pocket expenses, related to anything associated with the donor evaluation, surgery, and recovery. Again, you must reside in the U.S. or its territories. It's one grant for lifetime. We do hope, maybe not next year, but in the next coming years, the donor that is doing this program is hopefully going to expand this to New York and Illinois as well. David Atkins, who's the name of the person here, was actually the living donor to the donor who gave the fund to start this program. Ended up he was the best friend of the person that received the kidney, but they had means. They were able to fly in people from all over the country to get evaluated, and the donor recognized that's just not something people are able to do. Again, right now it's only Massachusetts, but if you want to learn more, it's kidneyfund.org/living-donor. And one other financial assistance program, this is available to patients in Arkansas, Oklahoma, and Louisiana. Again, either those that are on dialysis or living with a kidney transplant. It helps with costs associated with higher learning. So tuition, books, any other academic fees. It's up to $5,000 per academic year. We opened the applications up in late spring, early summer. As an example, we just closed this year. I think July 28th was the cutoff date. So, April, May, June, July is when we have that available. But if you go to kidneyfund.org and go to our assistance section of our site, you can find out how to apply for that. It's really meant to help patients either, try to find a new career or go back and get education if they're not able to do what they were doing before. I think my favorite use case of this program is we had a patient with a rare kidney disease who got a transplant, I think in May 2020, so right in the heat of the pandemic. And she was a critical care nurse. And obviously did not want to go back into working in ICUs in the middle of the pandemic with a recent transplant. And she went back to school, and we helped her, pay for that and get back into the workforce again. So that's pretty much the end of financial assistance programs. And again, as Jerry and Casey mentioned, please feel free to put questions in the chat. I'm happy to talk through that. I just wanted to highlight a couple of our other programs that we have as well. Our information on Fabry, I'm sure, pales in comparison to the wonderful work that the foundation already has. We really try to cast a wide net and then get our patients that we find to resources like Jerry's organization and to try to do this. But we do have some content as well on their website. We have a Talk to Your Doctor guide. We have an explainer video, and we have a webinar that we've done as well. And that's all free on the kidneyfund.org site or from our YouTube page. For those of you, who are work in the field, and if you're watching this after the fact and you have a child that's dealing with kidney disease, we do have a national virtual camp that is free. And in fact, there's one, I think, happening tonight. I think they're doing gingerbread house making tonight. This is a great program. It actually started, our offices at the American Kidney Fund are near the DC, Baltimore area. And we had partnered with Johns Hopkins Hospital for a camp, in-person camp that they did in 2019. We were all excited, ready to do it again in 2020. And then the pandemic hit. And we started really just doing bingo nights with the kids from Hopkins. But then they loved it and started to grow. And the team that runs this program for AKF started doing other things: magic shows, science experiments, gingerbread house making, painting pumpkins, as you see in the picture here. And now we've expanded it greatly. This is all virtual. Doesn't take the place of an in-person camp, which is something really special. But it's a great virtual opportunity for kids. And we host it at different time frames so we can get people from all over the country there as well. And we do have openings for that. Again, that information's on the American Kidney Fund website for an application. And just from an education standpoint, we do have an annual Kidney Action Week that we do every year. This is our patient virtual conference that we do. Although you'll see on day 4 of it this year, we are doing a day for professionals this year also. We had about 75,000 total views on last year's session, about 7,000 attendees throughout the week in different parts of it. Really kind of wherever you are in the process with, pre-dialysis or living with CKD from any cause is day 1. Day 2 is really about advocacy and some of the things that we're working on there, how to tell your story. Day 3 is some of the work we're doing around health equity, which I'll talk about in a little bit, as well as kidney failure, home dialysis, how to get on a transplant list. We have our day for professionals in day 4. And on day 5, we're going to do some rapid fire innovation talks on some of the new advancements coming out. As I'm sure all of you know, there's been a lot of advancements in the kidney disease space after decades with nothing recently. And we want to try to catch viewers back up on kind of some of the things that are coming and have happened. I mentioned our health equity program. We focus on 4 areas: one around prevention and disease management, just trying to make sure everyone has an opportunity to manage early stage kidney disease and deal with it. Making sure we have equitable access to home dialysis. So I'm sure all of you know it is something that is very much underused still in the United States, and helping people understand their options there. Making sure we have diversity in clinical trials. Tons of clinical trials going on right now, but not just in the kidney disease space, but across the spectrum. Lots of people are struggling to make sure it's representative of the people they're trying to serve. And of course, making sure that we have equitable access to kidney transplants also. Just one of our last couple slides as I start to wind down. If you're looking for information all the way from, honestly, early stages of CKD all the way through post-transplant, we've got over 700 kidney-friendly recipes on our Kidney Kitchen website, which is, you can find it kitchen.kidneyfund.org. And unlike so I've worked in this space. I actually worked in a food allergy organization previously as well. And even that organization, we didn't go to the links we did with this one, where we had not only nutritionists really look at everything and give us accurate numbers. We actually hired professional chefs to make every single one of these to make sure they actually look good, taste good. The ingredients are all, appropriate. The directions are all in the right order. So these have all been thoroughly tested. And for any kidney dietitians that may come across this webinar recording at some point as well, you can also actually create meal plans for patients. This ties into the USDA database, and all of this is free. Cooking videos, healthy eating guides. We have pretty much everything on our Kidney Kitchen website, and again, it's all free. And just one last piece I want to touch on, because I really like this program that we do. For those of you, I mentioned some of the advocacy work that we do. This is on our website as well. It's our Living Donor Report Card. We just published the latest one. We've got, I think, about 8 or 9 criteria we use to determine a state's grade, A to F, based on what policies they have in place to protect living donors. And that might be, guaranteed time off work, or a tax break, or making sure you're not going to be discriminated against from life insurance if you become a living kidney donor. So you can see the different states there. We're only up to 3 with an A, so we've got a lot of work to do. I think my advocacy team said we went to an overall grade of C this year. I think we were D as a country last year, so things are getting better, slowly but surely, but a long way to go. And you can go to that site, click on your state, and kind of see, where you may be behind if you live in a state that doesn't have an A rating. And just one last thing, I mentioned all our financial assistance programs. You can find them on our site at kidneyfund.org/get assistance. That's the same menu item when you get on our website as well. And one last piece that we're really excited about, we have partnered with an organization called Find Help to create a community resource finder. So if none of those programs I just mentioned from a financial assistance standpoint help you, like you're looking for housing assistance, or you need scholarship help in 47 of those other states that I didn't mention, you can actually put in your zip code, say whatever you're looking for, and you can actually get a list of local resources in your area to help with whatever it is that you're looking for. And that's all free as well, which is our community resource finder on our website as well. And with that, I'm happy to take any questions that anyone has.
In terms of eligibility, so you talked about people on dialysis or that have had kidney transplants. So I assume that it's people currently on dialysis. But what about the age of your transplant? If you had a transplant 10 years ago, are you still eligible for programs in your program?
That's a great question, Jerry, and I forgot to mention that. So we go up to 5 years post-transplant that we assist with our programs.
Okay. What about people that have kidney disease? For instance, I've had chronic kidney disease stage 3 for 20 years. Is there anything that I'm eligible to participate in?
Yeah, not at the moment, unfortunately. I wish we could. I mean, but so if we went that route, we're certainly open up to about 36 million more people. So we don't have that availability right now. I wouldn't say it's always going to be the case. One of the limitations we have, quite frankly, is also with our GMS site that I mentioned, which is where we put things in. It's kind of built right now for dialysis and transplant patients. We're looking to redo that system probably in about 2 years or so, and create kind of more of a sandbox opportunity where we can offer all kinds of things. But right now, the short answer is no. We do run into some patients who aren't working, don't really have any financial documents as well, or maybe their W-2 says one thing, right, and they just lost their job because they had to start dialysis. There is a way to submit kind of an attestation to get around that as well, just saying this is what my current income is. If you don't have financial documents, if you live in a cash economy, whatever it may be. But I think that's pretty much the only other question we usually get.
Well, I started pulling up the kitchen.kidneyfund.org, and I'd love to share my screen and show it to everyone. Is that okay?
Sure.
Okay. So look at this beautiful website here. And this reminds me of something we were talking about at the conference in terms of when you hear about a kidney diet, it really matters which stage you're in. So again, this is the kitchen.kidneyfund.org, and you get to choose which stage you're in, if you're on dialysis, if you're not on dialysis, or if you're already post-transplant. and different nutrients in your diet that should be monitored. I know sometimes kidney disease gets lumped together and we don't necessarily know how if we need to be lowering our protein in stage 1 or something like that. But we're all in some stage of kidney disease by being born. So this is kind of a neat place to see exactly where you are and then get all sorts of information from there. So that's a little plug just because I thought it was so neat, Michael.
Well, thanks.
And we also try really hard to not mention the word diet anywhere on here. I'm sure we've missed one or two, but we really try to say healthy eating so we don't have that, kind of negative aspect of diet anywhere, even when we're not talking about it in the traditional sense.
Mm-hmm.
And thanks, Casey. I think that's a good point because my question was related to financial assistance, whereas you're doing many other things on the website with your organization that are not related strictly to financial assistance. So
absolutely
resources for people in general. Well, great.
Absolutely. And like that Kidney Action Week that I mentioned that we do in March every year, the biggest use case of or attendees that we have there are patients in stage 3. It's by far and away the largest segment of patients that come to that.
Okay. Well, thank you, Mike. I really appreciate it. And thank you, Casey and Brittany. Yeah. If you're a primary attendee, then enter the word AFK. No.
AKF.
AKF, American Kidney Fund, in your chat box. I'm going to put a number in my random number generator. And one of you is going to win $50. Is everybody in?
We have 2 names ready to go.
Anyone else to want to put American Kidney Fund, AFK? You say it.
AKF. Yeah.
AKF.
Okay. Awesome. So we now have 3.
So we have 2 or 3?
3.
3 for the first one. So let's hit generate. And number 1, who's the first one in?
Jane.
So Jane, we're going to send you a $50 gift card. For the second one, it's anyone who has completed our pros survey. So if you have completed our pros survey or would like to complete it in the next 2 days, then enter PRO in the chat box. How many do we have, Casey?
Now, I believe we have 2 individuals with Fabry disease and 1 who's a family member. So it would only be the 2 with Fabry disease who are eligible.
2 in the random number generator for this one. 50-50 chance. How often does that happen?
Mm-hmm.
It's number 2.
All right. Now number 2 is
Anthony. Congratulations. You win the second $50 prize drawing. Well, thank you so much again for attending, and this was recorded so the people that aren't here, the other 28 people that signed up, can view the recording on when we post it, and hopefully we'll get a lot of people that have the opportunity to view Michael's presentation and benefit from it. So thank you all for being here tonight. The next 3 presentations are about mental health resources and other unique resources to the 3 organizations that are going to speak next. So we'll see you all next time.